Depression. Depression affects many Americans every single year. The great news is that because of advances in pharmacological technologies and pharmacology in general, we have medications to actually help patients get out of their depression. Let's kind of define what the DSM-5 says about depression. Here you go. Big book tells us all about depression. I will tell you that we're barely scratching the surface here when we talk about just depression. There's so many other diagnoses with depression with different types, different kinds. Let's run over just a couple of those. So again, we have this kind of definitions. These are very loose, guys. I will tell you that whenever you get into diagnosing these patients, there's lots of criteria that you have to check the boxes off to see kind of where we're at. The good news is that a lot of medications that we've already kind of discussed in relation to anxiety also help to treat depression. I think probably the most interesting one on this one to me is something called seasonal affective disorder. This is where, because the patient doesn't get enough natural sunlight, they have enhanced release of melatonin. Basically, the sleepy hormone is a lot more prevalent in their body, and they're always tired because they're not getting enough natural light. So it's really a good thing whenever you tell your kick your kids out of the house and say, get outside. It's okay. So 2 hours a day of being outside is really what people need in order to stay mentally healthy. Another one that we'll see is postpartum depression. I think I always thought that postpartum depression started like immediately as soon as the baby was born, but actually it can occur up to 6 months after delivery. They really think a lot of this is related to hormones. But we have to watch these moms really closely because yes, you can develop postpartum depression, but you can also develop postpartum psychosis. And that's where we see some of these really horrible stories on the TV and other places like that about moms that kill their babies or kill themselves because of the depression or the psychosis that goes along with it. So lots of different types of depression. Not all depressions are treated the same, but we do know that a lot of the first things that we want to do with them is we want to work with them to make sure that there's nothing in their medication box that's causing them to be depressed. So here's a couple of medicines and conditions, healthcare conditions that can actually mimic depression. So everything from taking too many steroids to having a vitamin D deficiency. You always want to get a good family history on these patients. You want to be sure for these patients that you need to assure them that there can be a genetic link. If mom had depression, then you're more likely to have depression. Schizophrenia, bipolar, you name it, all of those have some sort of a genetic link within the family ties. So some of it is genes that we can fix, some of it's behaviors that we can fix. Just like with any other process, we always start with our non-pharmacological treatments first before we dive into our pharmacological measurements. Medication may not restore the normal chemical balance. It may reduce the symptoms while the patient develops effective means of coping. This goes for any mental health disorder. Medications are a band-aid. These non-pharmacological interventions have to be paired together with the pharmacological interventions in order to make sure that the patient is treated in such a way that they can go on and have a normalcy of life. The other thing I want to talk about in here is electroconvulsive therapy. It sounds kind of brutal and it sounds horrible, but they basically shock the patient and it helps to kind of reset the brain so that depression is normalized. Okay, you can go onto YouTube and you can actually watch videos of electroconvulsive therapy. The good news is that it's really actually pretty effective, shockingly. So here's all the medicines for depression. We've already covered all of these medicines. So the good news is this is a very short little segment in regards to what you need to know about depression because we covered all these medications when we talked about anxiety. So ta-da, we're done. That was a short section.